So this presentation is on the spondyloarthropathies. Now, the spondyloarthropathies is a group of disorders that are autoimmune. They're related to rheumatoid arthritis, but they happen in the spine. And really, spondylo means spine, arthra means joint, pathy means problems with. So spondyloarthropathies are problems with spinal joints. There's a bunch of them, and they have, but they're distinct entities. They're all somewhat similar, and ankylosing spondylitis is the kind of the most common of them. Psoriatic arthritis is one. As well. We talked a little bit about psoriatic arthritis when we talked about psoriasis, and it presents a lot like ankylosing spondylitis. And there are things called reactive arthritis that that what this is an arthritis that is secondary to something that is further away. So this would be arthritides, like arthritis that goes along with irritable bowel disease. There's a syndrome called Reiter's syndrome, which is an interesting thing that it usually accompanies conjunctivitis and oftentimes an STI or some sort of urinary tract infection. But we'll start out with ankylosing spondylitis. So you've got to pay attention to this, because what happens is there's a sudden onset of back pain, especially in the sacroiliac region, in the absence of trauma or any sort of overuse. And there's usually some sort of a systemic disease, so a fever or something like that. So this is all on page 695. The old name for it was Marie-Strumpel disease. When I was in school, it was just changing to ankylosing spondylitis. Ankylosing means fusing, so this is inflammation of the spine that causes fusion. It's a progressive inflammatory arthritis of the spinal joints, especially of the discs. It's an inherited disorder. Usually it appears in men, and it runs in families. Way more men than women get it. And it usually comes down through the father for some reason. It's not on the Y chromosome, but it does have an inherited characteristic for it. The thing about it, and the thing that makes it confusing, is there's probably an inherited predisposition for it, but then there has to be some sort of an autoimmune trigger, usually by some sort of an infection. Now, one of my close friends has been recently diagnosed with this. His father had it, and so he knew all about it, and so he started to suspect, he was starting to show a lot of the signs and symptoms that he saw his father go through. It causes spinal fusion, so a loss of flexibility. Now, there seems to be other connective tissue disorders, Crohn's disease, ulcerative colitis, psoriasis, all seem to be somehow related to this. Now, there are no antinuclear antibodies present here, so it's not like lupus, and there's no rheumatoid factor, so it's not RA, and it just kind of is its own. So it's called seronegative, which means that the blood tests don't show anything. It doesn't show up in blood tests. Um, it's this chronic progressive uh, inflammation, and it usually starts in the SI joints. It usually starts down low. Uh, you know, a third have symmetric involvement of hips and knees, but it starts down low. And then it progresses up the spine. And as the joints become inflamed, the cartilage degenerates, and the discs start to ossify. The annulus fibrosus starts to die, and then the osteophytes move in, and it starts to like an ossification process. And the vertebral bodies end up squaring off. And it ends up almost starting to look like bamboo because the ligaments, the longitudinal ligaments, the anterior and posterior longitudinal ligaments start to ossify, and it causes kind of this bulging of superficial bone over the discs. And so those fusions are called syndesmophytes. Now, osteophytes tend to go transversely in their, so in degenerative disc disease, you see a growth of bone that goes perpendicular to the vertebral bodies, and syndesmophytes run parallel to the bodies, so they go over the discs. So on X-ray analysis, and on looking at the X-rays, you see kind of this look that vaguely resembles bamboo. It can also cause rib problems. So where the rib heads meet the vertebrae is right there, right at the disc. I don't know if you remember, but the rib heads go into the demifacets on either side the disc of the disc and the disc itself. So as that starts to fuse, then ribs start to fuse, and breathing becomes very labored and very difficult. So it starts to look like this bony kind of overgrowth that happens, and like I say, the bamboo spine. With it normally comes a kyphosis. And so this is a very typical kind of gait, or a typical kind of posture that you see in ankylosing spondylitis. You'll notice that that he's leaning forward. The SI joints look really fixed in this drawing. There's often a little bit of hyperextension in the knee because of it, and this kyphotic looking down posture because of the stiffness of it. And my friend is more and more like it seems that every year I see a little bit more kyphosis in him, and he compensates very well, but I can see him stiffening up. I see in his movements that he's compensating a lot for lack of mobility in the spine. Now, his father actually passed away he was bending over to put on his shoes, and because of the stiffness, he lost his balance and actually fell down the basement stairs, and because of the fusions, he ended up with fracturing his cervical vertebrae and died instantly because of the lack of resilience in his spine. So the fall was probably caused by the lack of flexion, and his death was caused by the lack of resilience in the spine. So often the presenting symptoms are low back pain. it often resembles a disc problem or an acute SI problem, but it doesn't have the same history. There's no history of trauma. There's no history of lifting injuries or falls or anything like that. You start to see a loss of mobility in the spine and the hips, so range of motion decreases. Again, it's autoimmune, so there are flares and remissions. And during the flare, you get systemic, as it is a systemic disease, you get systemic things. Malaise, fever, the big thing. Um, for some reason, it seems to affect the eyes as well. So, yeah. So the complications are fractures, like I was just saying. Uh, a, a lot of people, as this starts to take up space, it can put pressure on the intervertebral foramen and the vertebral foramen, causing a stenosis, called a equina sort of thing, or peripheral nerve root pressure. So it can present with um, sciatica, that kind of thing. Uh, Kind of an inability to move the ribs, so breathing issues, loss of lung capacity. So, especially in the inspiratory reserve capacity, people can't take that deep breath, and they also can't clear their lungs. They can't. The functional residual capacity increases as well, so they can't clear their lungs, which means that they're a little bit more prone to pneumonia and infection. The autoimmune attack of this connective tissue will also be heart valves, the stroma of the kidneys, the collagen in the eyes, you know, the stroma of all kinds of other organs can be compromised by this. Again, should stay away from echinacea and anything that is an immunobooster. Really, the diagnosis is very difficult because it's seronegative. They do blood tests, and when it says blood tests, it's really blood tests to rule out other things. If there's no positive blood test to this, it is a lack of positives to the other things that could be causing these symptoms. So it's really made, the diagnosis is made on symptomatology, on history. Um, if it's far advanced, then you start to see this bamboo spine and the syndesmophytes, and that confirms that that's what it is. But in the early stages, you don't get much of that, especially if it's restricted to the SI joints. So it's difficult, and so it takes a long time. It helps if there is a family member that has the diagnosis, then it makes it onto the list of differential diagnoses, and it's looked for more readily. Because it's more prevalent in men, women often get misdiagnosed. They get diagnosed with sacroiliac syndromes and those sorts of lesions. And they may actually not follow the exact same sort of patterning of this. And so it'll present rather atypically. You treat this with immunosuppressant drugs, anti-inflammatories, and what you want to really do is, even though the person doesn't feel like exercising because of their stiffness and their loss of range of motion, maintaining as much function as possible really slows the progression of it. It's an important consideration. When during a flare-up, I wouldn't be recommending too much massage. When it's not flared up, massage is indicated for muscular spasms and muscular things. Help maintain as much suppleness in the spine as possible.